This is Heart Rhythm TV, and I am Daniel Alyesh, here with a spotlight article for Heart Rhythm Case Reports. And I'm joined today by Dr. Barry Maron of the Lahey Clinic. Welcome.
Hello.
So the article of interest that we have, another case of Commotio Cordis, and actually probably one of the most cohesive presentations of this condition. Now, to refresh everyone's memory, this condition really captured our attention January 2023 when Damar Hamlin went down during an NFL nationally televised game. We saw the pathophysiology in real time. We also saw the value of prompt CPR and defibrillation. But this case really takes it a step further. And so, Dr. Maron, I'm going to proceed to our first slide here, but tell us a little bit about this case, a lot of firsts with it, and the overall completeness of it.
Right. We have everything here to document Commotio Cordis. There is nothing missing for full documentation. What happened here just a few weeks after Damar Hamlin that we all saw in a obscure high school basketball game in Romania, another Commotio Cordis event occurred. It just happens to be that we have full video. We have the EKG after the event. We have documentation of the blow on video. And we know that there was no underlying cardiac disease or abnormality that would explain collapse. So very often when there is a Commotio Cordis event, everybody gets to have their own opinion about what it really was, okay? Since Commotio Cordis is counterintuitive, for sure, as we're going to go through this video show. So, it's easy to be a naysayer and, suggest, for example, underlying cardiac disease or some other variable that could explain it, when it's really Commotio Cordis, a chest blow triggering ventricular fibrillation. So we go back to the beginning here. Maybe, yeah, hold it right there. Okay, so that's the arrow is pointing to the so-called victim of Commotio Cordis is a loose ball that everybody's going for on the court. This is a very obviously very usual event during a basketball game. Basketball is really a non-contact sport, but occasionally there is bodily contact. And you can, if we advance, I think we can see the blow itself, the one that has the stop frame that has the circle around it. Let's try to, there's the collapse. Okay, there's the loose ball. There he is. It's almost, and you have to really concentrate on.
Well, I think it's really interesting is that you have it from multiple camera angles. You see a scuffle, right?
Yeah.
And then you see the blow. You'll see the blow right
there's
there.
The blow. Yeah, there's the blow.
And then a few steps and then collapse. And I think that you allude to in your article that this is what you have seen. The patients can walk a few steps in ventricular tachycardia or ventricular fibrillation.
Right, it's typical of Commotio Cordis that there would be some consciousness after the blow while there is a ventricular tachyarrhythmia. There are a lot of examples of that. For example, I know of one case in which during softball, a line drive hit a second baseman in the chest. The ball dropped in front of him. He reached down, picked up the ball, and threw the runner out, and then collapsed, full cardiac arrest. So individual tolerance for VTVF, but it is very typical of Commotio Cordis and not typical of a cardiac arrest due to underlying cardiac disease. So there we see the VF that was obtained in the ambulance. There was very prompt cardiopulmonary resuscitation. That's another amazing aspect of this. It's a high school game. There's hardly anybody there, but the resuscitation was almost immediate with defibrillation. Everything worked to the benefit of the patient.
So Dr. Maron, a couple of things that really struck me in reading your article, a lot of firsts with this case. Number one is, typically this is the first attribution to basketball, right? So really a relatively non-contact sport, but things can happen. And here's the first demonstration. You comment on 22 countries where Commotio Cordis has been reported, adding Romania here to the mix. Additionally, you also comment on this is the most cohesive presentation, meaning you have a video documentation of the blow, you have a documentation of the EKG, and then you also have a coronary angiogram that was okay, so no anomalous coronary arteries, normal LV function on echo, and no LGE on MRI.
Correct.
So really, really a complete presentation. I want to probe you a bit. You say something about there are doubters when it comes to Commotio Cordis. Can you elaborate on that point?
Sure. I think, a lot of people think they're smarter than Commotio Cordis, that it's too weird or counterintuitive for a lot of people, that there must be an underlying cause. It couldn't be the mechanism that we believe is responsible for Commotio Cordis, and that is that the exquisite timing of the blow to the upstroke of the T wave appears to be what triggers in a susceptible individual the ventricular fibrillation. So the blow has to be over the heart, and it has to be timed exquisitely. Those observations come from a remarkable animal model that was originally published in the New England Journal from Mark Link at Tufts. And we believe, in the absence of any better information, that is the mechanism. And since it's so exquisite in terms of timing, that might explain why there are, an excess of chest blows and very rarely resulting in ventricular fibrillation.
And you comment on, to be kind of specific, the last 20 milliseconds of the upstroke of the T wave. That's when the blow and the heart is most susceptible at that point.
Right, according to the model, yeah.
So then you go on to, presenting this case quite beautifully. You talk about the complete workup, and then a lack of recommendation for an ICD. And you allude to why. Can you elaborate for the viewership, thinkings around ICDs and why it was not offered in this circumstance?
Well, I guess why would it be? There is The cardiac arrest was due to the chest blow. There is no other case that we know of that is Commotio Cordis that was repetitive either. So there's no underlying abnormality that could explain a subsequent cardiac arrest with or without a chest blow. So we've never recommended or had the reason to recommend a primary prevention device. And this is not hypertrophic cardiomyopathy. There is no cardiac abnormality, and that's proven to be the correct decision because no one has had a second arrest that we know of.
Thank you. And then, Dr. Maron, can you comment on, so you've obviously, you're an expert in this field. You've seen a lot of patients with this issue. After a workup like this, what are you saying to the patient as far as moving forward in athletics?
Well, that came up, obviously. This Romanian high school student is now in the United States. He's a pre-med student at Cornell, just by coincidence. And he came with a vest, okay? The recommendation was no vest and no ICD. Be important to go forward because he doesn't really have a disease. Whether he should participate in a sport that involves chest blows is another question.
So I guess I'd like to take us to our final question here. Commotio Cordis, tremendously visible and really, really, quite frankly, shocking presentation in a lot of athletes. Clearly, prompt identification, CPR, defibrillation are very important. But what do you say to our viewership as parents, coaches, trainers? How best do we prevent, identify, and manage this condition?
Well, I don't think you can prevent it. This is secondary prevention, not primary prevention. As was the case here, remarkably, at a high school game. It was the case for the NFL on Monday Night Football. Prompt resuscitation and defibrillation. And recognition that this is a cardiac arrest requiring defibrillation. When we first started reporting these cases of Commotio Cordis, it was, for the general public, very counterintuitive. And I think the literature penetrated so that, there's a recognition of what is really going on when there is a collapse, that it is requires prompt intervention. And that, I think, was our contribution. We demonstrated in one paper over a 15, 20-year period a clear decrease in the reported episodes of fatal Commotio Cordis. And I think it is less fatal when it occurs now because of the attention that has been paid to these collapses. That's the only thing you can do. Secondary prevention. We told him to live a normal life, college student. If he wanted to do intramural sports, there wouldn't be any reason not to do that. Whether he wants to be in a situation where you could expect to have a blow to the chest, that's another question, I guess. Probably something to avoid. Other than that, there do not seem to be any long-term consequences.
Thank you very much, Dr. Maron. Thank you for your contributions to this field. And also thank you for, really presenting a very, very detailed and complete case. So,
Yeah. Yeah, it is that, and I think it's an important case. Even though a single case, it goes beyond that.
well, thank you again, and thank you all for tuning in to Heart Rhythm TV. This has been a Case Spotlight Heart Rhythm Case Reports.